telling the truth in a world of lies. That is true Christianity. Welcome, Catholicos, Catholics, Orthodox Christians, all who seek the truth. In this video, I'm going to go over two articles, one from the New York Times and one from CNN. So YouTube should have absolutely no complaints about that one, because it is coming from the establishment of establishment newspapers or sources. So, and it is about rushing a vaccine to market and what are the dangers involved with that, and what were the standards used to produce that vaccine. So the two articles we're going to be dealing with are one from CNN, which was published September 1st, 2020. And title of the article is, in their health section, it's called Past Vaccine Disasters Show Why Rushing a Coronavirus Vaccine Now Would Be Colossally Stupid. And we are in the colossally stupid realm at the moment. And in the other article, which was published in the New York Times, and that was published September 23rd, 2020, and again by two doctors, which we're going to go over, and it's called, the title of the article is, These coronavirus trials do not answer the one question we need to know. The one most important question we need to know, these trials, none of them answer. And we're going to see what the New York Times has to say about that. Now, which one should I start off with? We'll start with the past vaccine disasters of CNN. So the article, as I said, is called Past Vaccine Disasters. Show why rushing a coronavirus vaccine now would be a colossally stupid. And that's written by Jen Christensen of CNN, September 1st. And it starts off, says, vaccine experts are warning the federal government against rushing out a coronavirus vaccine before testing has shown it is both safe and effective. Decades of history show why they are right. But of course, nobody listens to reason these days, because reason seems insane to the stupid. So the FDA signals vaccine green light early. So it says, they're worried that the FDA might be moving too quickly to approve any sort of a vaccine, and this agency could consider an emergency use authorization for a COVID-19 vaccine before late-stage clinical trials are completed. So this is the warning, and it did actually, the FDA did authorize now two vaccines under the emergency use authorization. And what does CNN say here? An EUA, an emergency use authorization, is not the same as full approval, as it can be withdrawn. So again, so it's not approved. It is approved under emergency use authorization criteria, which is not the same as full approval. So, and it says here, like, it gives you an example, what happens with vaccine approvals. So the FDA usually spends months considering it, just considering after they get the results, months. Not a week, or actually take a vote on it in a session, as has happened in the Moderna vaccine, as I believe. So an EUA, an emergency use authorization, is much quicker. Only once before, so in all of history of the United States, only once before has the FDA given a vaccine this lesser standard approval. This lesser standard approval, only once in history. And it was for, they wanted to do they gave it to soldiers for an anthrax vaccine, mandatory, and then a whole bunch of soldiers got sick, and they sued the government, the government, and So the judge put a hold on the program. So what do? So the Department of Defense asked for an emergency use authorization that then overrode the court ruling in 2005. So basically, I say, well, fine, the soldiers are getting sick. They don't want to get it anymore. All right, we're going to do emergency use and force them to take it. Well, actually, they did it as a voluntary basis because so that's what happens. And it says FDA approvals process which take months or years, not a couple of weeks. Now, when the vaccine making process has been rushed, there have been bad outcomes. I'm quoting CNN. So there's the Qatar incident on April 12th. Again, these are just a few examples. There's lots of examples, but these are just a few from CNN. On April 12th, 1955, the government announced the first vaccine to protect kids against polio. What happened with this rushed vaccine? So 200,000 kids got it. 40,000 kids out of the 200,000 got polio from the polio vaccine. Some had low levels, a couple hundred were left with paralysis, and about 10 died. Then another one called monkey trouble. And this is again from the polio vaccine. So it says here from 1955 to 63. So that is 9 years of vaccination. Between 10 and 30% of polio vaccines were contaminated with a simian virus, a monkey virus, simian virus 40, SV40, which, and this has been transmitted to millions of Americans. And it says here, some studies showed that a possible link between this virus, the simian virus, which was contained in the polio vaccine, and cancer. Isn't that special? And then there's another section, the epidemic that never was. In 1976, scientists predicted a pandemic of a new strain of influenza, a novel strain of influenza, a novel coronavirus, because influenza is a coronavirus, called swine flu. More than 40 years later, some historians call it flu epidemic that never was. So President Ford, so it was basically pushed by his advisors. Oh, we're having a pandemic. We've got a pandemic flu. We have a pandemic flu coming called the swine flu. So we got to do something. And it could be worse than the Spanish flu, which is exactly what we hear now. So they panicked President Ford. So Ford being cajoled, he put forward a vaccine, warp speed vaccine. Warp speed, one of the stupidest things Trump ever did in his administration. A warp speed. Let's give the big multi-billion-dollar pharma companies, give them billions out of taxpayer money, and then buy their stuff for free. Guarantee purchases. That's a pretty good deal if I'm a big pharma company. So anyways, Ford cajoled them to put forward the vaccine that was, Ford was cajoled, so basically kind of forced, pushed to put forward the vaccine that was hastily put together. It wasn't as hastily put together as what we have these days. So 40 million people got vaccinated. And later on, this vaccination campaign was linked to a neurological disorder called Guillain-Barré syndrome. Guillain-Barré syndrome, or however that is pronounced. A neurological disorder. Isn't that special? It was a kind of a fiasco, Merkel said. The good news is there was never an epidemic of swine flu. And actually, we're going to see what the final real death totals for the year 2020 compared to 2019 are. And we're going to see if there was ever a pandemic. So we were safe. That shows you what could happen in rushing a vaccine. So we got, and it says here, and there's have a little picture on your on my left, so however it looks on your screen here. So this is, it says here, he signed up for a coronavirus vaccine. That's one of the trial participants and one of the one of the vaccine companies, using a method, this mRNA vaccine. What does CNN say? This vaccine trial using a method, this new vaccination, this mRNA vaccine, that's never been used in humans. It has never been used in humans, and yet it was given emergency authorization use, was never tested on animals, took really 2-3 months of trials. All right. Now the next section says a colossally stupid move. Because of course it was the Trump administration, so they got to, of course, attack it. And it says here, this is one of the most ridiculous things I've heard this administration say, Merkel said. All it takes is one bad side effect. And how many side effects have we already seen with the 2 vaccine rollouts? Just go online and just say side effects and see allergic reactions, severe allergic reactions. Already there are several deaths recorded. The trials had some severe reactions and several deaths recorded. AstraZeneca and I believe Moderna, and the trials were stopped in Brazil and they were stopped in the UK and they restarted again. But I guess that doesn't really matter. But this is written in September, so it says here, all it takes is one bad side effect, and we have a whole list of them. Even the UK government says we have no idea how this affects fertility and pregnancy. We don't know in their official vaccine flyer to the doctors. So one bad effect, all it takes is one bad side effect to basically botch a vaccine program that we desperately need against this virus. It's a prescription for disaster. So too early emergency use authorization for a vaccine could cause a nightmare scenario for several reasons. 1, the vaccine may not be safe. Okay. 2, if it's not safe, people will lose faith in vaccines. Okay. 3, if a vaccine doesn't offer complete protection, which actually even the World Health Organization and even Pfizer said it does not going to prevent you from actually contracting COVID-19 or even passing it on. So what's the point? People will have a false sense of security and increase their risk. 4, if a substandard vaccine gets an emergency use authorization, a better vaccine may never get approved. So this is, ladies and gentlemen, boys and girls, children of all ages who like to actually think and consider the facts, is an article from CNN Health and the colossal stupidity of rushing a vaccine to the market. Now we're going to go to the other one, which is the one I wanted to do originally on, from the New York Times. The New York Times published this September 22nd, 2020, and is written by 2 doctors. Dr. Doshi, he's associate professor at the University of Maryland School of Pharmacy, and Dr. Topol is a professor of molecular medicine at Scripps Research. And the title of the article, as I said before, is "These coronavirus trials don't answer the one question we need to know." We may not find out whether the vaccines prevent moderate or severe cases of COVID-19, which they will tell you. The FDA only requires that they reduce the risk of a mild case, not a moderate, not severe. So you got a little cough and a sniffles. So this vaccine may reduce the risk of that, and then it is considered a success, as effective. So this is what the article says. If you were to approve a coronavirus vaccine, would you approve one that you only knew protected people only from the most mild form of COVID-19, or one that would prevent its serious complications? So it says, if you're going to approve a vaccine, are you going to approve one which only protects people from the most mild, not even just mild, the most mild form of COVID-19, or actually the ones which will cause them to, go to a hospital? The question obviously is, so the answer is obvious, it says, which is, anybody with a brain will say, yeah, of course. You would want to protect against the worst cases, not against the most mild case. The most mild case. No, you wanted it to protect you against the worst cases. That's the whole point of the vaccine. If I get a little sniffles and a headache, yeah, okay, whatever. In a few days, I'll be just back to normal. So big deal. And I don't need to have a vaccine which has never been used on humans, as CNN said, mRNA, which has skipped animal trials and given emergency use authorization, so the substandard authorization, to pump it into my body. Anyways, so it says here, but that's not. So it says you would want one which works in the worst case, but that's not how the companies testing 3 of the leading coronavirus vaccines candidates, Moderna, Pfizer, and AstraZeneca, whose U.S. trial is on hold, are approaching the problem. So this isn't how. So they're not approaching it on how to stop the most severe cases. No. According to the protocols of their studies. So they themselves have released them because they're basing them on the requirements of the FDA, which they released late last week. A vaccine could meet the company's benchmark for success, if it lowered the risk of a mild. Lowering the risk of a mild. It doesn't even stop an infection. It doesn't even stop the mild symptoms. It will lower the risk of a mild COVID-19 infection, but was never shown to reduce moderate or severe forms of the disease. So as long as it reduces the risk of a very mild case, then it's a success. It's successful. It's effective. Or the risk of, so it it will be considered a success even though it never shown to reduce the moderate or severe forms of the disease, or the risk of hospitalizations, admissions to the intensive care unit, or death. So none of that matters. As long as it reduces the risk of a most mild case, then it's a success. All the other stuff, moderate, severe, hospitalizations, intensive care, even death, doesn't have to show that it even affects any of that stuff to be considered a success. To say a vaccine works should mean that most people no longer run the risk of getting seriously sick. Well, that's the whole point of a vaccine, isn't it? That is, let me repeat again, not what these trials will determine. So don't be brainwashed by the parrot media who just repeat stuff and you listen to it with like being brain dead, like a zombie, listening and going, safe and effective, good, safe and effective, good. These are the scientists and these are the facts. These are facts revealed by their own documents of Pfizer, Moderna, and AstraZeneca. And actually the requirements of the FDA for emergency use. So the Moderna and AstraZeneca studies, tells you how many people. It'll say 30,000. So will it involve 30,000 participants? And there still will, and that's in September and got approved in December. Alrighty then. Pfizer will have 44,000, so it didn't even have them yet. Half of the participants will receive 2 doses of vaccine separately by 3 or 4 weeks, and the other half will receive a saltwater placebo shot. The final determination of efficacy, again, there's a, I'm not going to go into it now, but you can look it up yourself. There's a difference between when the efficacy and effectiveness. They don't mean the same thing. They don't mean the same thing. They don't mean the same thing. So look it up, difference between efficacy and effectiveness for a vaccine. What does that mean? You look it up yourself. Do some work. So the final determination of efficacy will occur after 150 or 160 participants. So just 100, I think it was like 160 for Pfizer, the final thing. So after 150 or 160 participants out of 44,000 develop COVID-19, and then efficacy will be determined after just 150 people get COVID-19 out of the 44,000. Oh yeah, it's effective. It's safe and effective, but that is only if the trials are allowed to run long enough. Pfizer will look at the actually Pfizer said they had to go the trials over 2 years, not for 2 months. And actually now they have said that after all these people have taken their vaccines, they will have to continue. Pfizer themselves are saying, so it'll be the same for Moderna. Moderna, by the way, has never, ever produced anything, any vaccine ever in its history. At least Pfizer has a history of production of vaccines and medications. Pfizer said, like they said it on CNBC, I believe, that they will continue to monitor those who have taken their vaccine for 2 more years for any side effects. So which means that we are human guinea pigs. Human guinea pigs for lab rats for another 2 years, so Pfizer can look at what happens to the lab rats who took the vaccine in the next 2 years. Which means, because the trial will like 2 months, 3 months, and we already have a whole bunch of side effects listed. So if you're stupid enough to take the vaccine, well, it's your problem. My only advice, if you want to poison yourself, go ahead, but don't poison your children. Just spare them. So it says here again, I want to just say that. So the final determination of efficacy will occur after 150 to 160 participants develop COVID-19. But that is only if the trials are allowed to run long enough. Pfizer will look at the accumulating data 4 times, Moderna twice, and AstraZeneca once. They're just going to look at the data once. That's enough for them to determine its efficacy, if efficacy has been established, potentially leading to an early end of the trials. So yeah, as soon as and there was a joke actually, it's as soon as Pfizer came up and said, oh, ours is 90% effective, and then within a day or two, I think it was, who was it? I think Moderna, no, the Russian vaccine company Sputnik 5 said, oh, ours is 92% effective or something, a bit more. And then a day or two after Moderna came out, ours is 94% effective. And then Pfizer came back again, ours is 95% effective. Okay, all right. It's like a bidding game. It's like an auction. Okay, who's going to raise? Who's going to raise? Who's going to raise? Give me more, give me more. Going once, going twice. I think Pfizer won the deal because they went up with the most. And I think AstraZeneca came out and said, we're 94% effective. Yeah, okay. Knowing how a clinical trial defines its primary endpoint. So this is the point. This is very important. Knowing how a clinical trial defines its primary endpoint. And the trial was reducing the risk of very mild cases of COVID-19. And then you're a success. You're effective. You're efficacious. The measure used to determine a vaccine's efficacy is critical to understanding the knowledge it is built to discover. Where it's critical to find the knowledge is built to discover. That's the whole point. Like if you know the criteria of success, then you know what they're trying to find out. In the Moderna and Pfizer trials, which the FDA gave them emergency use authorization, even a mild case of COVID-19, for instance, a cough plus a positive test. So basically all I need is a cough. A cough and get either a positive test, like, with the rapid antigen test or the PCR test running at 40 cycles. And I'm not going to repeat how accurate these things are. And actually, Fauci himself on a YouTube video, the virology podcast, says anything above 35 cycles for the PCR, the gold standard of testing, is basically dead material. There's nothing. Even if you get a positive, it means nothing at and above 35 cycles. But the FDA tells you to run the PCR at 40 cycles. The New York Times had an article before said it says you tested positive, but maybe you shouldn't have. That's the title of the article and in the New York Times. And it says the vast majority of testing is by labs for the PCR is run at 40 cycles. Very few at 37. And Fauci said anything at 35 or above is a false positive. So all you need is a cough. So for the Pfizer trials, all you need is a mild case. And the Moderna and Pfizer trial, in the Moderna and Pfizer trials, even a mild case of COVID-19, for instance, a cough plus a positive lab test would qualify. Yay, we've got a COVID case here. He's got a cough and he tested positive. Wow. Would qualify and muddy the results. AstraZeneca is slightly more stringent, but would still count mild symptoms like a cough plus a fever. So you got to have two as a case. All right, people never had coughs and fevers before, 2020. Only moderate or severe cases, and the doctors here writing this article for the New York Times say only moderate or severe cases should be counted, not a little cough and a positive test. But that's, again, not the criteria if we used to determine the success of these vaccines. These never before used on human beings vaccines, which skipped animal trials as well. There are several reasons this is a problem. Again, this is in the New York Times, written by two highly educated doctors. First, mild COVID-19 is far more common than severe COVID-19, so most of the efficacy data is likely to pertain to mild disease. But there is no guarantee that reducing the risk of a mild COVID-19 will reduce the risk of a moderate or severe COVID-19. Severe COVID-19. It continues. Should I skip that? No, it doesn't. So basically, it does because again, these testing, all the trials are being tested on super healthy individuals. They're not testing them on frail women, frail people, older people, pregnant women, children. None of these people are being tested when they were testing the vaccines. So what happens when you give it to an old person? What happens to give it to a pregnant woman? What happens to the child in her womb? What happens if you give it to children? No data. So it says, it says here, this is the case with the influenza vaccines. Get your flu shot, get your flu shot. I have never in my entire life gotten a flu shot. And I don't remember the last time I got the flu. Thanks be to God. So it's not my own thing. But eat healthy, try to exercise, get some vitamin D, get some zinc, walk, smell the fresh air, relax, sleep, reduce stress. And if you don't have any other, unfortunately, some, diseases in your body, you will, even if you get the flu, you'll be able to fight it just fine. Anyways, but that's my personal opinion. Don't take it as gospel. I'm not a medical doctor, but I do have a brain, maybe better than a medical doctor. This is the case with the influenza vaccines. Let's see what the actual doctors say. Which, again, what do these flu vaccines do? which you see the people lining up to get them. What do? They reduce the risk of what? Of mild disease in healthy adults. So that's all the flu vaccines do. They reduce the risk, not of a severe flu, of a mild flu, and not in sick older people or sick or vulnerable people, but only in healthy people. So basically it has no effect on anybody else. And that's the same standard being used for the COVID-19 vaccine. But there is no solid evidence they, meaning the flu vaccines, reduce the number of deaths, which occur largely among older people. In fact, significant increases in vaccination rates over the past decade have not been associated with reduction in deaths, meaning it's useless. You are just pumping poison into your body to reduce the risk of a mild flu. So maybe a headache and some sniffles and a cough, I don't know. That's it, a mild fever. That's all it's effective for. Second, Moderna and Pfizer acknowledge their vaccines would appear to induce side effects that are similar to the symptoms of mild COVID-19. So the Pfizer and Moderna vaccines will induce, like they will give you symptoms of a mild COVID-19. And what is the point of this vaccine? Is to reduce the risk of a mild COVID-19. So what is the point again? What is the point? Can you answer me that? If the vaccines ultimately provide no benefit beyond a reduced risk of a mild COVID-19, they would end up causing more discomfort than they prevent. Third, even if the studies are allowed to run past their interim analysis, stopping a trial at 30,000 or 44,000 people after just 150 or so, actually they stopped I think at 160 COVID-19 cases, may make statistical sense, but it defies common sense. So stopping the trial at 150 people got cases of 150. Oh, I got the sniffles and I tested positive. Okay, you're a case. Okay, well, our vaccine is effective against reducing the sniffles. But this defies common sense. Giving a vaccine to hundreds of millions of healthy people, based on such limited data requires a real leap of faith. It is a leap into insanity, not a leap of faith. It is a leap into the darkness. There may well be insufficient data to address the aged and underrepresented minorities. There will be no data for children, adolescents, and pregnant women, and actually older adults, since they have been excluded from the trials. Vaccines must be thoroughly tested in all populations in which they will be used. None of these. Okay. So the trials need to focus on right clinical outcome. And what does that mean? It is not reducing the risk of a very mild case of COVID-19, which means a little sniffles and maybe a slight fever, maybe. But that's the outcome they're testing for now to give them success. So what is the right clinical outcome that these doctors on the New York Times newspaper say, which is required, which the trials need to focus on, is whether the vaccines protect against moderate and severe, especially severe forms of COVID-19, and be fully completed, the test being fully completed, not rushed to market, and then we still have to observe people for 2 years after they get our vaccine to see what happens to them. AstraZeneca got, again, you'll find the article on CNBC, got protection from the UK government. They told them, AstraZeneca representative, they said, well, we need to be basically given protection against anybody, like we cannot be sued for any side effects occurring from the vaccine, because the head of one of the CEOs, or one of the heads of the company, AstraZeneca, told the British government that as a company, they cannot, and I'm almost verbatim what I'm saying, they cannot take the risk that in 4 years side effects develop. So AstraZeneca, which would go for all the vaccine companies, can't take the risk that in 4 years we have side effects from their vaccines. So they wanted to be protection from any indemnification. They wanted to be protected. Nobody can sue them. Nobody can demand money from them. Nobody can do anything. So, and they were granted that protection, as have all the other vaccine manufacturers. So it's not even 2 years. Now, Pfizer said we have to keep an eye on people for 2 years. AstraZeneca says we don't know what happens in 4 years. We don't know. But we'll give you your vaccine if you want it, but we don't know. We're not responsible. You want it, we'll give it to you, but we're not responsible. The British government said, sure, why not? Here you go. Go ahead. It is, and it ends up by saying, it is hard to imagine how much higher the stakes can be to get this right. Cutting corners should not be an option. So again, it is by Professor Peter Doshi, is an associate professor of pharmaceutical health services research at the University of Maryland School of Pharmacy, and an associate editor of the BJM, a medical journal. Eric Topol is a professor of molecular medicine at Scripps Research, where he founded and directs the Transitional Institute, which is focused on individualized medicine. So this is from the New York Times. So this is the criteria, so you understand. These are the criteria of success for effectiveness and efficacy. And what are they again? That the vaccine reduces the risk of a very mild case of COVID-19, which means a little cough. It has there is no testing for moderate or severe cases, or hospitalizations, or intensive care unit admissions, or deaths. None of that. As long as it reduces a very mild case of COVID-19, approved. And that's what happened. So here you go. 2 articles to consider. I'll place the links for them so you can read them all if you wish, which is basically what I did most of them anyways. So again, this is from New York Times. The coronavirus trials don't answer the one question we need to know. And from CNN, past vaccine disasters show why rushing a coronavirus vaccine now would be colossally stupid. That is it. That's all. Hope you enjoyed this video. Please subscribe to the channel, like the video, share the video, and press the notification bell so you can get notified whenever I do any more videos. And I'll see you next time. Bye-bye.